Today, the key findings of a report were officially released to stakeholders in the business of children, their rights and issues. The Belize Multiple Indicator Cluster Survey Mix 5 was carried out in 2015 by the Statistical Institute of Belize in collaboration with the Government of Belize and the United Nations Children's Fund, UNICEF. It was developed 2.5 decades ago and is an international household survey in several areas on the status of children and, by extension, their mothers. One such area is childhood mortality, and the statistics show that Belize has made progress over the past 15 years.
Another really significant measure of our development is the infant mortality rate, and this went from 15 deaths per 1,000 15 years ago to 9 deaths in the last 5 years. So that is an area where we have made improvement and where MIX has provided really valuable data for us to monitor our development. We also look at vaccination. And again, MIX has helped us to see that we are making strides with our vaccinations. We know that the children are being vaccinated because we have seen the cards as part of the survey. And when we look at the overall level of vaccination, children have been fully immunized. 78% of our children have been fully immunized. That means they get all the vaccines and all the doses that they're supposed to get. However, there is still a little bit of work to be done because about 5% of the children between 24 and 35 months still haven't received any vaccines.
A total of 5,242 households were surveyed from across the country. A factor that influenced the results was economic status.
We look at all sorts of things, including household characteristics, assets owned by the households and assets owned by individuals in the households. And we use all of these to put together to form an indication of how well off households are. When we release the final report, you will see that for the most part, all indicators are analyzed by wealth index. So you will see that persons, the poorest in quintile 1, how they're doing compared to persons in the richest quintile, quintile 5.
The results of the survey will be used by respective ministries and private agencies to develop strategies and mechanisms to address the indicators. In the case of nutrition, 5% of children are malnourished, 15% are stunted, too short for their age, and 7% are overweight. While the numbers have improved when compared to the previous study, nutritionist Robin Daly of the Ministry of Health says that there is need for further interventions primarily in the south and remote areas.
What we are looking at is to improve or scale up our case-by-case management of malnutrition. If you look at the previous mixed results, it has shown that malnutrition was very high in the southern parts of Belize, like we're talking about Stan Creek District and Toledo District. So what the ministry has done is we have employed what we would call social advocates for nutrition, and their responsibility is to literally work along with children and parents who have children, especially the women that have children under 5 years of age, to address malnutrition. So we have case-by-case management. So we find all the children that are under 5, and we ensure that if they're malnourished, they get this supplement, they're on it, they do growth monitoring, they're weighed, they're measured, the parents are educated about nutrition. A lot of work has been done in terms of villages because that's where we have poor accessibility to clinics, to clinic care and stuff. What we're noticing with the mixed results is we're seeing some increases in some other districts for stunting. So from this, what we will propose now is to scale up. So we have the 2 southern districts covered. We want to do a preventative strategy. So we're going to look at having the same kind of advocates, the nutrition advocates, go into the other districts as well and do case-by-case management of children under 5. We do see there is a prevalence of obesity, and this is alarming to us as well because remember this target group that the mix covered is under 5. So that is telling us that even though we have a large amount of malnutrition, we also have overnutrition as well, which is obesity. And many times people like to see the chubby babies, they're so cute, but they do put them at health risk. So again, the education and the monitoring goes both ways.
While the key findings were released today, the final report will be completed later in the year. Duane, Moody for News 5.